Is your organization an accountable care organization? Does your provider participate in an accountable care organization? These are things that you need to know. That an ACO works? Some people don't believe in them, while others think that it's going to be the way to fix rising costs of healthcare. Either way, you need to look at what some of the pioneers of the concept have accomplished. They just announced that 123 new organizations have been accepted into the program, and they're estimating that it will help over 1.5 million people. They say that there's been a decline of cancer patients and the costs associated to those patients, and the healthcare providers that are caring for them are declining because of their participation in the ACO. Other studies are saying that the administrative burdens are so bad for the providers that even though they believe in the concept and they want to participate, that it's too overwhelming and that they cannot participate. Either way, if you're not an official ACO, just because you incorporate some of the criteria into your treatment plans for your patients, it does make their diseases and their lives easier to manage. A hospital or another healthcare provider, if they work voluntarily providing high-quality care to Medicare patients, that is being referred to as an ACO or an accountable care organizations. These providers are paid in untraditional ways. They get a fee for service, meaning they get a higher amount than what they normally would, but they're accepting responsibility for how the patient care is provided, and that they're getting the high-quality care, and that they're doing preventative services so that they can decrease acute care services and other services needed in the hospital for these patients. Certain diseases will have criteria that the providers must track. For example, a lot of your patients, if they're overweight, they can lower their health issues just by losing weight. So an ACO is going to strive to meet criteria for their patient. The criteria is defined as a percentage of patients age 18 or older with the calculated body mass index in the past 6 months or during the current visit has to be documented in the medical record, and if the most recent BMI is outside of what they consider a normal parameter, the doctor is going to have a follow-up plan documented within the last 6 months, or they're going to document it during their current visit. So a normal parameter for a BMI for patients aged 65 and older is greater than or equal to 23 and less than 30. If they're age 18 to 64, it's greater than 18.5 and less than 25. You have to track this information in your electronic medical record system. So how do you become an ACO? You have to apply and you have to be accepted into the program, and it requires a minimum of 3 years participation in the program. For more information on the details and specifics of getting involved in an ACO, visit the websites listed on the screen. Even though ACOs have been around for a little while, that you only have a few options of ways that you can participate in an ACO, and a couple of those options, as you noticed, they're no longer allowing people to join those programs. So you can join the shared savings program. That means that you will facilitate coordination and cooperation among your providers, and you will do the fee for service. The advanced payment model and the pioneer model are currently not accepting any new applicants for those programs. Even though ACOs can provide great benefit to both the provider and to your patient, you need to consult legal help because there are issues with HIPAA, and depending on the states that you live in, the laws can be different and could affect your organizations differently. So for example, to participate in an ACO, you have to share health information. And it can be very valuable, but it could contain financial information, individual identifiable health information, things that are sensitive like drug and alcohol abuse, if the patient is HIV or AIDS positive, what their mental health status is. So with HIPAA, you can sometimes share the information, but if you're in a HIPAA Plus state, some of that sensitive information is not allowed to be shared. And so you need to be very careful on what can and can't be shared and what you are and aren't sharing. And again, you may not be able to participate just because you have to share this information to be an ACO and your state is prohibiting you from it. So consult with legal counsel before proceeding with this. If you have any other questions, you can contact our consultants and we can help come in and set up ACO or get your providers participating in the program, you can visit our website at www.excelhcg.com or give us a call at 770-918-9083.